Hi everyone, I'm Allison Johnson, Manager of Communications and Community Engagement for the new Windsor Essex Acute Care Hospital. As part of Windsor Regional Hospital's commitment to ensuring the community's voice is included in every stage of the planning process for the new hospital, we recently launched a survey. We wanted to find out what you think is most important when it comes to the design of the new hospital. Today, we're going to take a look at some of the results from that survey and find out how they'll be used to help guide the planning process as we get set to kick off Stage 2 planning. In November, we launched the Design Principles Survey. We asked hospital staff, community partners, and members of the public to share their priorities for the new hospital design. Participants had the option to fill out an online survey or share comments by mail or by phone. The survey was promoted in the media, on social media, on the hospital's website, and it was also sent to our community partners and our ambassadors by email. The survey ran for 4 weeks, and in that time, we received just shy of 1,000 submissions. When we started to go through those submissions, very quickly, some themes started to emerge. Those who responded to the survey told us they want a state-of-the-art building that is accessible, with large private rooms and more space for families so they can be part of the care. They want better access to services, plenty of parking, a supportive work environment for staff, and a hospital with the capacity to provide timely, patient-centered care, and a hospital that will serve the community well into the future. Note here that patients are right at the heart of these responses. In fact, the word patient was mentioned more than any other word in the survey, though it was followed closely by parking and access. Now, using the responses from the survey, we established a project vision and a set of design principles that will guide decision-making as we move forward through the process. The vision is to create a state-of-the-art treatment and healing environment for all those who we care for, a supportive workplace with the latest technologies to allow all of our staff to provide the most efficient and highest quality care in a new hospital that supports well-being and has the capacity to provide timely, patient and family-centered care for generations to come. The guiding principles are based on some of the themes that started to emerge when we started to dig deeper into the responses. And again, no surprise, 63% of the submissions talked about using this opportunity to make the hospital experience better for patients and for families. Now, here is just a small sample of the related responses. Note you'll see words like dignity, privacy and confidentiality, wayfinding, parking, access for all, including those with physical disabilities, access to daylight, and spiritual care, including Indigenous healing facilities. And there you have it, private rooms and private washrooms. Those came up multiple times. Now, all of these factor into the first planning principle, and that is outstanding patient, family, and visitor experience. The planning team will focus on creating supportive and health-promoting spaces with opportunities for privacy and respite, as well as space and amenities that are accessible, welcoming, and support a diversity of culture, age, ability, and gender. Now, this means meeting or exceeding accessibility standards, creating access to outdoor areas, and incorporating daylight and outdoor views into the design. We heard that one a lot. Also planning multi-faith and spiritual spaces, including Indigenous healing areas, senior and family-friendly spaces, and gender-neutral washrooms. Another notable theme in the survey was safety and quality. People told us they want private rooms to prevent the spread of infection with appropriate ventilation, and larger rooms and large hallways so that patients can move safely around the hospital. And this leads us to the second principle, high quality and safe care. This includes support for integrated care delivery, enabling best practice and evidence-based care. And this will be achieved by incorporating private rooms and sufficient airborne isolation rooms, meeting or exceeding contemporary standards for hospitals and infection prevention and control, and separate areas for patients, staff, and materials to move around the hospital. In this way, we will no longer have to share an elevator with soiled linens, for example. Now, many responses mentioned a design that includes operational efficiencies, with efficient patient flow to minimize wait times, allow care teams to spend more time with patients, basically a design that limits the amount of walking for both patients and staff. So an operationally efficient design will maximize efficiency and promote timely access to appropriate care while optimizing the use of resources. And this will be achieved by standardizing rooms and spaces, designing flows that achieve timely and effective delivery of services, and co-locating interdependent services to reduce unnecessary travel throughout the hospital. The next principle will ensure that the hospital is the right size for today with the flexibility to adapt to meet future needs. And we heard this repeatedly. The rooms need to be bigger for patients. Patients have trouble maneuvering around the current and cluttered rooms, and they need more space. We also need room to grow. This would be to accommodate long-term population growth, an aging population, and also to handle any future pandemic and endemic surges. To accomplish this, the design team will consider strategies for accommodating future growth and balance the need for additional capacity and space efficiency. And this will mean incorporating approaches for growth such as adjacencies, soft space, and shell spaces that can be developed in the future. And it also means planning multi-use spaces while ensuring there's sufficient space for equipment and for supply storage. The topic of research and education was a popular one in the survey. People want space for learners and for engagement. They want proper training space for staff, students, and the opportunity for more collaboration within the research community. So using this principle, the design team will promote interprofessional rather than discipline-specific spaces and amenities and provide opportunities for collaboration as well as for quiet study. The planning team will look for ways to create multi-use, shared and accessible meeting and learning spaces and incorporate areas for care planning, research, education, community engagement, and brainstorming. Creating a healthy, safe, and inclusive workplace is the next principle, and both staff and the public feel that it's important to have a design that promotes safety and a place that staff can take a break, can decompress, store their belongings. Now, under this principle, planners will focus on incorporating space, technology, and equipment that protects and supports staff in care and service delivery. Also, creating spaces that are accessible and support wellness and diversity, and this includes optimizing adjacencies and designs to reduce walking distance for everybody. Safe facilities for changing, showering, securing belongings, respite and exercise, and again, creating access to daylight and outdoor areas, as well as meeting or exceeding existing guidelines and legislation. Words like innovation and state-of-the-art were popular in the survey. At a minimum, people want to be able to charge their devices and access Wi-Fi. Others would like to see technology used in the admitting process, for example, or to reduce wait times, a fully digital hospital, and smart technology. Using the principle, the teams here will focus on a design that enables state-of-the-art care delivery and transportation of specimens, supplies, medications, and patient meals using automated systems and robotics, and also using technology to improve communication and collaboration among providers, patients, and families. This means planning Wi-Fi and charging stations throughout, exploring systems like automated guided vehicles and clinical automation, providing online registration and scheduling, as well as space and technology for virtual visits and consults. The last principle focuses on sustainability. People told us they want to explore ways to minimize emissions, reduce the environmental impact in the planning, and explore energy-saving design features. So the team will focus on a design that incorporates environmental management systems to minimize consumption of energy, water, and materials, and minimize use of toxic materials, limit waste, and enable the practice of responsible disposal. To do this, the team will look for ways to meet or exceed Leadership in Environmental Design, or LEED, silver certification requirements, consider condensing boilers and high-efficiency chillers, efficient pump designs, and heat recovery chillers, and water use reduction using efficient landscape. And again, the vision and these design principles that we shared with you will all help guide the decision making as we move through stage 2 and beyond in the planning process. On behalf of the team, I want to thank everybody who took time to complete the survey, share your feedback, and provide input into all of this. It's an exciting time, and we look forward to working with you more in the future, introducing you to other members of our team in the coming weeks and months. We hope that you'll consider to join us throughout this journey. Please visit our website, windsorhospitals.ca, and subscribe to our mailing list, where you'll find out future opportunities to get involved. I can tell you that we have coming up later this year some town halls that will focus on program and service specific areas, where you will have the opportunity to find out more about the planning that's going on in these areas and give further input into some of these specific areas. So we look forward to sharing all of that with you going forward. And thanks again for helping us with this part of the project.